Health inequality is a problem faced by many countries, and disadvantaged groups systematically suffer from worse health outcomes. Marginalized groups such as the urban and rural poor, women, indigenous peoples, people living with HIV, people who use drugs, people in detention and other closed settings, minors, and mobile and migrant populations suffer from human rights violations that bar them from accessing TB prevention, diagnosis, and treatment services. While national TB programs in most countries have focused on promoting access to effective TB treatment and care through government health facilities, there seems to be a gap in meaningful community participation and civil society engagement in TB responses. The Philippines has the third highest rate of TB prevalence in the world. There are about 1 million Filipinos with active TB in the country, with more than 70 Filipino lives lost to the disease daily. With this number of cases, it is strategic to harness the power of the community of TB survivors and those living with the disease in preventing and combating tuberculosis. The Global Accelerator to End TB, USAID's new TB business model, ensures the efficient and effective fight to end TB by building local commitment and capacity with a focus on locally generated solutions. A robust civil society and community involvement and participation have proven their efficacy in the global HIV and AIDS response. Replicating this strategy in the TB response is envisioned to be an invigorating approach to improve TB outcomes. In line with this model and in partnership with the USAID, Achieve is launching the initiative called Strengthening Civil Society Movement Towards a People-Centered TB Response in the Philippines in Metro Manila, Central Luzon, and Calabarzon. Organizations from Visayas and Mindanao will also be engaged in the 3-year project that shall accomplish the objective through building a unified advocacy network for a rights-based, gender-transformative, and people-centered TB response. Achieve will mobilize and recruit civil society organizations implementing TB programs and projects, organizations of TB patients and survivors, and organizations of communities who are vulnerable to or at higher risk of contracting TB. Capacity building of the members of the network to implement effective advocacy, not just for improving or changing programs and policies, but also for lobbying for sustainable financing for the TB response. They will also be engaged in generating feedback from communities through a community-based monitoring app. Achieve will roll out the CareTB app to various areas and sites. The CareTB app is a community-based monitoring tool that will track treatment adherence of patients, map out and locate treatment centers, and generate feedback from communities accessing TB services, including experiences of discrimination and human rights violations. The information collected through the app will be utilized to inform the network's advocacy. The network aims to amplify voices of people affected by TB by launching a stigma reduction campaign through various activities and platforms. The campaign is intended to reach a broader audience, from the general public to the decision makers and policymakers. Ending TB requires a collaborative effort among all sectors. Empowered communities will definitely make a mark in the TB response. We need to secure a future free from TB. And this starts now.